I'm Sanj Bassi. I'm a consultant adult and paediatric neurosurgeon dealing with brain and spine problems across the whole of the age ranges.
Does the Harley Street Clinic have a dedicated children's and paediatrics team?
In the foundation of the Harley Street Clinic was cardiac surgery, and before we started neurosurgery there, which is about 15 years ago, they'd set up very, very complex heart surgery, and on the back of that they'd built up, I think, one of the best intensive care units for children that I've come across. That I think includes across all of London, whether that's NHS or private. So what they have there is a dedicated team who can look after extremely sick children, and actually the children in neurosurgery are not anything like as sick as those who have heart surgery. With consultants who are again dedicated paediatric anaesthetists, radiologists, intensive care doctors from across the London teaching hospitals. It's a fabulous service, and there's a dedicated children's, almost like a hospital within the hospital, children's hospital within that setting. And again, the fortunate things about the private sector are you don't have the same limitations on funding as you do elsewhere, so we really have everything we need, and I think it's a superb service with great facilities, and it's safe.
And what's the benefit of patients of bringing together a multidisciplinary team?
As doctors, we become more and more specialised. There's a lot more that one knows. There's a lot more information there is about disease, and no one person can cover every aspect. I can manage a child with, for example, cerebral palsy and hydrocephalus. I can manage their shunts very well as a surgeon, but there are so many other aspects of that patient that needs to be looked after, whether it's from the neurology side of things, maybe fits, play specialist, physiotherapist, and actually managing that with a team. And that's where the word MDT or multidisciplinary team comes in. Each person brings their expertise to the individual patient. And I think that works synergistically to provide much, much better care. So we tend to work with most of our patients in a team setting, whether that's from cancer work, which has been stipulated, almost an expectation in law that it's done in MDT, to even some of what seems to be the simpler things. So we do work very much in a team setting, which we feel provides all the expertise under one roof for that individual patient.